learn about all the consultations so if you understand laser hair removal, that sets you up for understanding almost everything else we do with lasers and energy-based devices. So I think the previous talks were excellent and gave us a great kind of outline. These are my disclosures. As you guys know, this is where it kind of started with Ruby lasers, and although we don't use these commercially now, it was a great wavelength in terms of treating. Why is laser hair removal important? As Kelly said, it's the most commonly performed procedure in the world, right? And so that's another reason to make sure you kind of understand it. It's also the most litigated procedure in the United States of America because it's done so much, there's so many complications. So I'm gonna just skip through this, but isn't it amazing that we can go from there, that hairy back to that kind of result? Even though we've been doing this for close to 30 years, it's pretty amazing. The endpoint that you look for, particularly when you're treating lighter Fitzpatrick skin types, which is the focus really of this talk, is to look for perifollicular edema and erythema. This is the endpoint with a diode laser, so I think everybody on stage and Christine will know that that's what exact laser it is. And sometimes when you're using the shorter pulse duration, you might actually see the hairs get ejected, whereas with the longer pulse duration, you might get more singeing. And the pulse duration, Elliot is going to talk about, because that's going to be a key role for treating darker skin. So when you're treating lighter Fitzpatrick skin types, same thing as we were talking about before. You kind of want to run through these different kind of parameters. And fortunately, with laser hair removal, right, your target is melanin, but ideally you're trying to get the melanin that's in the hair shaft, right? And remember, your actual target, your chromophore and your target are different because the melanin absorbs the laser fluence and then it heats up, but you want to destroy the stem cells in the bulge and the bulb area. So that's the extended theory of photothermolysis because you need that heat diffusion. But generally, with lighter skin, you don't have as much competing epidermal melanin, so that's the key with that. Fluence, pulse duration, spot size, and skin cooling. I'm going to just run through these briefly. So this is the absorption spectrum in green for melanin. And when you have lighter Fitzpatrick skin types, you really can use almost any of the wavelengths, starting from the Ruby all the way out to the 1064 ND YAG. Generally, if they're lighter skinned, you're going to want to pick one of the more kind of infrared wavelengths. So they don't make a Ruby commercially, at least in the United States, so more of an alexandrite or a diode, only because the 1064 hurts more and you don't need that safety profile as much for lighter Fitzpatrick skin types. So that's where I tend to kind of use these lasers. So as Christine mentioned, this was the original laser for hair removal. There's actually studies in the literature that show that you can follow these people up 2 years and beyond, and there's a permanent efficacy. But as people have said earlier, this is not complete removal. I call it, if you have a very particular patient, it's laser hair reduction, not laser hair removal. The alexandrite laser, also very safe for skin types 1 through 4. There are actually people that advocate it for all skin types, and some of the devices have clearances for all skin types, but I think Elliot will tell you what his favorite go-tos are for darker skin. Same thing, long-term efficacy has been published in the literature with this as well, with 76 to 84% hair reduction with 4 treatments. So it kind of matches what Kelly was saying, her generic 6 to 8 treatments to get in the 90% hair removal. The diode, this is also another very popular device that is used kind of worldwide. Has also been FDA cleared for skin types 1. It's safe for skin types 1 through 4, but it actually has been FDA cleared for all skin types. And same thing, long-term efficacy, 4 treatments, 84%. This is with a 9mm spot size. One of the things that I think we touched upon earlier, the bigger the spot size, right, the less energy you have to put in, and it hurts the patients less, but you also get deeper penetration with it, so you tend to get better results, and the devices have kind of evolved to have bigger and bigger spot sizes, which is really nice because you can zoom through these treatments. I'm going to just skip over this because I know Elliot's going to cover it. So fluents, when you're treating Fitzpatrick skin types 1 through 4, higher fluences give you better results. So there is a dose response. The higher the fluence, the more likely you are to get a side effect, because that epidermal melanin starts sucking more and more of that energy in as more of it goes in. Your devices often come with a guideline, and actually many of them are pretty darn good. But this is not the way that, at least for the 4 of us, our mentor taught us to not practice cookbook medicine. We look for clinical endpoints. So you want to look for that perifollicular erythema and edema, and the highest tolerated fluence is going to give you the best result. And doing a test spot will always, always, always be a way to keep you out of trouble, where you can try several different fluences, and then you can pick the one that has no side effects and the highest fluence. Pulse duration, so with lighter Fitzpatrick skin types, you have a broad range. You can go as narrow as some of the devices have 1 and 3 millisecond pulse durations, and that's been an advance because before it used to be a little bit longer, and that really helps you get those finer hairs, as Christine talked. The hairs actually get lighter and thinner, and they get harder and harder to treat and target. So if someone's lighter Fitzpatrick skin type, you can definitely go with a very short pulse duration. Spot size, we talked about this. So the bigger the spot size, the less scattering you're going to have, and the lower relative fluence you're going to need to use. So it will actually hurt the patient less. And think about it from your efficiency point of view, you can get through the treatment faster. Imagine treating a back with a 9x9 device when now we have ones that are much, much larger. This was a study I did with Dr. Kilmer. And it's a much larger spot size, and it also uses a suctioning, and it makes the treatments a lot faster. Skin cooling, this is always important, and I think someone's touched on this as well. Helps protect the epidermal melanin. Not as much an issue with lighter Fitzpatrick skin types, but definitely something where you can get into trouble with it. Plume, that's another important issue. Smoke evacuators are helpful. The devices with the shorter pulse durations, the 3 and 5 millisecond ones, those are the ones that are going to generate more plume than the devices that singe. Complications, so with lighter Fitzpatrick skin types, you tend to get more of this kind of erythema because the lighter Fitzpatrick skin types are not great at producing pigment, but in darker skin types, this can be a much more upsetting procedure. I've actually heard of patients getting scarred from laser hair removal, especially if you're doing areas on the face and you're putting a lot of heat in. You can actually get a little bit of a hypertrophic scar and burn. One of the things that is not a horrible side effect, but with laser hair removal, you actually want to overlap, right? And if you don't have that overlap, you're going to create areas or zones that you're not actually treating. And so early on in treatment, you can get something like this. And so it's not something that you can't come back and clean up with the subsequent treatment, but just something to keep in mind. Paradoxical hypertrichosis we talked about. Eye safety is super important because this targets melanin. And as Christine kind of alluded to, there's a lot of things that we can do better. And so some of the other advances that we have that make this treatment a little easier to do in our office, there are now devices where you can kind of program in the desired overlap that you want, and you can kind of just roll the handpiece around. There's also devices where you can kind of mark a grid, and they have like a smoke evacuator built into it. So it kind of helps guide you and give you the ideal amount of overlap. And so in conclusion, this is the most important and most commonly performed procedure. Ideal candidates are the lighter Fitzpatrick skin types, and Elliot's going to get into treating the darker ones, which you can do. So this is something that we can do for everybody. And Elliot, thank you for your work on that. And there's many great devices available. If anyone wants to talk about my favorites, I can do that afterwards. Thank you so much for your time and attention.